Hi, I'm Dr. Radhika Kopikar, a board-certified dermatologist and founder of Kopikar Dermatology Skin Hair Laser Clinic in Vikhroli East, Mumbai. Have you noticed dark-colored spots on your face or discolored patches of skin on your body? And if you wonder that what are they and how do they appear suddenly on your skin, then let me tell you, do not panic. I assure you that they can be treated. Today I will be talking about these visible dark spots on your skin, a condition known as hyperpigmentation. Before getting into this, let's start with some basics about your skin. Your skin is the largest organ of your body, and one of the primary functions of the skin is to protect you against external factors such as sunlight, chemicals, bacteria, and temperature. Melanin is the substance that is responsible for the unique color of your hair, your eyes, and your skin. Melanin is produced by melanocytes. These are the cells present in different parts of your body. Melanin also absorbs the harmful UV rays and protects your cells from the sun damage. But mind you, that melanin alone is not enough to protect your skin and your body from the ultraviolet rays. You must also protect yourself by using appropriate clothing and a good skincare regime, including the use of regular sunscreen whenever you are outdoors. All of us are concerned about our skin, its color, its texture, and its overall appearance. Pigmentation is one of the commonest reasons, especially facial pigmentation is one of the commonest reasons why patients seek a dermatologist. Some skin tones, especially those of Asians, are more susceptible to pigmentation disorders than others. This is the reason in general some of us have to deal with patchy skin or dark spots, and these concerns hardly go away with a home remedy or self-medication. So it is important for you to understand what exactly is hyperpigmentation, what are its causes, some do's and don'ts, and how to deal with it. So here is a small informative video explaining all of this in detail. Sit back and have a look.
Hyperpigmentation means darkening of the skin in any part of the body. Hyperpigmentation of skin is seen on cheeks, forehead, lips, around your neck and eyes, elbows and knees. The causes of hyperpigmentation can vary. It may be due to endocrine disorders, hormonal therapy, drug reaction, acne, eczema, or maybe due to pregnancy. But don't worry, as there are many treatment options available in the form of depigmenting cream, face wash, sunscreen, moisturizers, and other medical treatments. For successful management of skin hyperpigmentation, it is very important to adhere to your treatment regimen. Hyperpigmentation is a long-term treatment. It might take time to deliver desired results. However, for better results, it is important to keep patience and continue your treatment duration and treatment frequency as recommended by a doctor. Apart from your treatment regimen, take preventive measures and follow the do's and don'ts as suggested by a doctor. Do's: avoid excessive sun exposure to the areas of increased pigmentation. Wear a hat, sunglasses, sun protective clothing, and seek shade when outside. Wear sunscreen daily with an SPF greater than 45 and remember to reapply. Use a face wash and moisturizer well suited for your skin type. Adhere to treatment regimen as recommended by a doctor. Now, don't forget using your skincare regimen, which includes sunscreen, face wash, moisturizer. Don't aggressively scrub your skin. Don't use home remedies such as lemon juice or abrasive scrubs, as these can worsen hyperpigmentation. Don't use cosmetics as advertised. Don't self-medicate. Don't stop the treatment. If no effect is observed, talk to your doctor. And don't smoke. Hyperpigmentation is a manageable condition. However, it is important to listen to your doctor's instructions. Thank you.
I hope this video was helpful and answered most of your questions. Let me still simplify it and empower you by explaining what you can do at home to help your pigmentation.